of YouTube and Instagram Live. So, how was your last week? And I hope you give some good results in your clinical practice. And I would like you all to share so that we all can learn together. Before we start the session, let us have some few cases which I got very good results with that. One of the most important thing in practice which I have seen and that you should all remember, that is the art of interpretation. Now, why I'm telling you interpretation? Because sometimes you interpret something and the remedy which comes is basically very simple, polycrest. So you don't have to go to or jump to the so-called rare remedies. I'll discuss a case first, a very interesting case, and that case would the patient had a very typical symptom of cough. Good morning, Dr. Alexandra. Cough and spitting of blood. The patient had cough, and spitting of blood, and immediately the patient added one thing, that spitting of blood, and it is brown red in color. So whenever the elimination of the body is syphilitic, for example, blood coming out, brownish blood, so this becomes syphilitic. So make sure that you basically understand to prescribe in this syphilitic symptom rather than just going for the cough symptoms of dry cough or expectoration cough or modality of cough. Of course, if you open the repertoire, there are so many remedies. We added few remedies and the results were amazing. I hope everybody knows the remedy with the blood, the spitting of blood, and it is brownish in color with this weather, cold weather. The patient was, and it is raining also here in Nagpur. It was getting wet in the rain. But see how the remedy progresses, And of course, I gave the patient a simple drug, Rustox, and the patient was much better. Welcome, Dr. Shweta, Dr. Upal. So here it is very important to understand. A lot of people come and tell me that whenever there is cough, cold, coryza, in most of the time we prescribe the remedies like Rustox or common remedies. It is not so. Sometimes the symptoms are very important. I'll discuss a beautiful case today. Beautiful case I had. This is a case of an old man about 95 years of age, suffering from severe constipation. He had severe constipation, and the stools were very bad. The patient said that he's lying on the bed. There is a spine problem. The patient said that when the stools are coming, it pricks, and it is long. That's long, slender stools, and it pricks. It comes out from the anus, and it has to be pulled out. And of course, if you get this symptom in your practice, there are few remedies which are very common that comes to your mind. Anybody? Welcome, Dr. Sultan, Wasim. So the patient says that the stools are very hard. In Hindi was saying it is like nails, long nails, pricking the anus. It is very painful, and sometimes it has to be pushed from, taken out from the anus. Which remedy comes to your mind? There are a lot of remedies. If anybody could answer that, give some idea. You can think about remedies like selenium or thuja, a lot of remedies. Yes, phosphorus also. So I prescribed selenium, then thuja, then phosphorus, nothing worked. And the patient was a very selective patient. Patient had his own say everywhere what he did in life. और उसके बाद क्या हुआ that one of his assistant was there who was looking after him. So he said that his brother had carcinoma of rectum, and this patient, when he asked his brother what were your complaints, and the brother told him that I had severe constipation, and silicious also, I had severe constipation, and the doctor did not diagnose it properly, and after that we came to know that it was cancer. And that fear of cancer was there in the patient's mind after that incident, and that we took for prescription. Silicious is also there. If you open the repertory, it is written fear of cancer, especially of rectum when there is no functional complaints. The only remedy there is platina. This is the importance of understanding the patient even in acute disease. I prescribed platina 1 m. and now I get a call from the patient, is much better. The stools have become soft, it does not prick, it comes out automatically. This is the importance of understanding. Otherwise, constipation, stools large, stools pricking, it has to be pulled out. Thuja is there, selenium is there, silicia is there, opium is there, calcarea is there, lot many of drugs are there. The case is so simple, but just adding to that fear, and Platina 1M gave good results. And if I saw the patient also, patient very selective, wants everything what he wants, what everything is on time, as good as he wants, and that is also Platina. Such a beautiful drug picture of Platina, I saw in that case and understood Platina in a different aspect only, That is the importance of knowing a whole case rather than prescribing only for stools or urine. Of course, you might get results sometime, but for a cure, it is important to add that one mind element. I hope you understood this case. Dr. Yogita, welcome. Dr. Sahu, welcome. So we were talking just about Rustox. There are in Nagpur there is raining, so everybody would prescribe Rustox if the elements from getting in rain, wet in rain. But you have to add few symptoms of Rustox which are very important. Otherwise, what happens? The patient comes with cough, cold, coryza, and most of them match arsenic, most of them match bryonia, Rustox, and you are confused what to prescribe. So there were a lot of questions on the WhatsApp. The pillars are how to differentiate. Now, how to differentiate, that is basically knowledge of mathematics, very important. In Rustox, if you want to differentiate, one thing is very important: influenza with aching in all the bones. That is a very important symptom of Rustox, influenza with aching in all the bones. Now, the second question everybody you should arise, that aching in bones is also present in Jupiterum perforatum. So how will you think about Rustox? That is also right. If you have seen my previous webinars, I have discussed very precisely something about Jupiterum perf in relation to fever. I think that was in my webinar. Yes, that was in my webinar when I took that case of dengue fever, explained exactly how is the fever and how Jupiterum perf behaves. So I think that you should see my webinar. Then last November series of webinar of dengue fever. I have told very precisely something about Jupiterum perf. So we will not talk about that. We will talk about Rustox, how to differentiate Rustox. Saturday at what time? No, Saturday. No, I have a series. We just finished the November webinar series. Of course, the paid series. हमने paid series complete किए November की. December में we have 50 millisievert potency, 11, 12, 13 and 14th. I think we have sent the flyers also. If you wish to join, you can join and I'll discuss LM potency with cases. As far as I go, I think I've prepared it very well and you'll also enjoy LM potency. Now we have started paid webinars on Zoom so that everybody can discuss the case and we have discussed that case. Just let me finish Rustox so that I can go further. In Rustox, one thing is very important that everybody should remember. It's a very important symptom of Rustox. The respiration is difficult after walking. When the patient walks, the difficult respiration increases. That is a very important symptom of Rustox. And add to that, difficult respiration on lifting. मतलब पेशेंट बोलता है मैं बहुत भारी काम करता हूँ ना, मेरी सांस फूल जाती है. That is also Rustox. So and of course difficult respiration in windy weather. जब बहुत हवाएं चल रही हो, पेशेंट बोलता है मेरे को सांस लेने में तकलीफ होती है. When the pulsatilla says जब बहुत खुली हो हवा हो मेरे को सांस आराम से आती है. In windy weather, if there is difficult respiration, do think about Rustox. One thing is very important Rustox, and it is present only in Rustox, whatever I have understood Mathematica, that the respiration is obstructed when there is swollen sensation in the epigastric region. Patient बोलता है मेरे को बहुत गैस लगती है यहाँ पे, पेट फूल जाता है सांस लेने के टाइम पे. That is a very important indication of Rustox ecodendron. This is how you have to differentiate your Mathematica. Otherwise, everything would be same: arsenic, Rustox, bryonia, everything same. So this is the Rustox. That was Jupiterum perforatum. Okay. This is I just take one question. What is the medicine for nose block at night with dry heat breath through mouth must? Of course, today, whatever weather is there because of the cyclone effect in India, there are a lot of cases where there is obstruction of nostrils, where there are cough, cold, and coryza. Remember one thing, whenever the patient says that obstruction, especially, and you have mentioned very nice, a good modality, especially at night, and the patient cannot breathe through nose, think first of ammonium carb. Okay, ammonium carb is a very, very important remedy. Second, if we have added one thing also, that the heat part we have added, you must think about three remedies which are very, very important in our practice. First is ammonium carb, second is Naxomica, third is Lycopodium, fourth is Calcarea. These are the very, very important remedies which you have to think. Of course, there are a lot and lot of other remedies, but these 4-5 remedies are very, very important. You should definitely get the result. Of course, there are some rare remedies also, but first of all, common remedies are very important. Ferrum iode, I think, is there, and arsenic album is also there. So this is the answer to your question. Welcome, Akash. Saturday Life, yes. So I hope you've got the flyers of the 50 milliseconds potency, which we are starting on 11th December, 12th, 13th, and 14th. 4 days at a stretch, because I don't want to have gap, because I will not be able to finish LM potency in one lecture, so it can go to 2 or 3 lectures. In detail, I will talk about it. That's why I want to take every day, so that everything is fresh in your mind. We have got few registrations. If you want to register, the flyer is there, the number is also there. You can definitely register in that number. So obstruction of the nostrils. One of a very important symptom, that you have to remember in obstruction of nostrils, sometimes it is in the night and sometimes in the morning. बहुत बार पेशेंट आके हमको बोलते हैं, डॉक्टर साहब जब भी मैं सवेरे सो के उठता हूँ, whenever I get up in the morning, पूरा नाक मेरा बंद रहता है. Whenever I get up in the morning, the nose is obstructed. So which remedy comes to your mind? Anybody? Which remedy comes to you? The patient comes and tells us, पेशेंट बोलता उठ के कि मेरा नाक सवेरे उठ के तो बंद ही रहती, मैं सांस ही नहीं ले सकता, आई कैनॉट ब्रीथ. विच रेमेडी कम्स टू योर माइंड? एनीबडी? So these are very, very important symptoms. You must think about Calcarea carb, Kali iode. Kali iode is a fantastic remedy. If you have not used Kali iode in your practice, do think about that remedy. Kali iode, Calcarea carb, and of course, I think Kali bichrome is also there. But Kali iode, one of the very, very important remedies, and if you have not used Kali iode, it has a wide variety of action. Kali iode, it contains iodine. That's why it is a very, very important. It is said that in Kali iode, the tip of the nose is red and hot watery discharge. The discharge is thin. Patient बोलता है ना, डॉक्टर साहब मेरे नाक में से गरम गरम पानी निकल रहा है, मेरे नाक में से गरम गरम पानी निकल रहा है और नाक पूरी लाल हो जाती है. That is a very, very important indication of Kali iode. Tip of the nose red, profuse watery, hot discharge and thin nasal discharge. एंड द फ्रंटल साइन, बोलता है ना पेशेंट फ्रंटल नाक बहुत जाम है, यहाँ भी बहुत जाम लग रहा, सब भरा हुआ लग रहा है, दैट इज काली आयोड. Such an important remedy, this is Kali iode. Of course, one question is sudden suffocation in 40 years, chronic chilly man, he is also asthmatic, please help. See, a sudden suffocation, whenever you have a symptom of sudden and suffocation. So if you have, of course, if I was to ask you some more symptoms, that is very important. Sudden suffocation, whenever you have symptoms called as sudden. Now, sudden pain in joints, sudden nose suffocation. Of course, suffocation may be because of nose, because of throat. So, we'll discuss of nose and then of throat, because you have never written. We have always, we have given the number also. If you don't have the number, I think I'll ask my sister. You can write down the number 9011 303 171. So suffocation suffocation because of coryza. Think about thuja, think about zincum metallicum, think about bratacar. But then most important thing is normally that suffocation is mostly in the chest, and there is suffocation and the patient cannot breathe. Now, if this is the complaint, now there are a wide variety of remedies which you must think about, and it can cause palpitation also. So first of all, whenever suffocation comes in your mind, one remedy, two remedy, three remedies which should be in your mind, and then try to differentiate. First, carbohydrate, second ammonium carb, third kali carb, fourth natramur, and fifth antimtat. Related to chest, there is lot of patient बोलता है डॉक्टर साहब मेरे को बहुत घुटन हो रही, ऐसा लगता है कि छाती में से सांस भी नहीं आ रही. Give kali carb, give ammonium carb, give aconite. Think about sulfur. Think about nitramur. These are remedies when there is sudden suffocation, the patient cannot breathe. Of course, then we have with palpitation and a lot of other things also. But these 4-5 remedies are very, very important that you must think about in your practice. Yeah, to register in December series, we have the numbers. You can register for 50 millisol potencies. So this is very important. And third thing, one thing is very, very important, that is palpitation. नॉर्मली नो बहुत पेशेंट बोलता है बहुत घुटन हो रही है और दिल की धड़कन बढ़ गई है, सडन palpitation, and then especially because of exertion or because of sudden palpitation, then you must think about, in palpitation it is a, I don't know which remedy you think about, but first remedy you must think about is strychnum purum. Strychnum purum, it is an alkaloid of Nux vomica. पेशेंट बोलता है कि मेरी छाती फूल ले सकती, मेरे को ऐसे जम से सांस लेनी पड़ी थी. स्ट्राइचिनम प्यूरम. सेकंड, थिंक अबाउट ब्राटाकार. थर्ड, थिंक अबाउट मैंगनम मेटालिकम. एंड द पेशेंट कम्स एंड टेल्स यू, डॉक्टर साहब व्हेनेवर आई वेक, जब भी मैं सडनली उठता हूं ना, मेरे को बहुत घबराहट होती है, इसलिए लगता है सांस भर के आ रही है, मैं सांस नहीं ले पाता हूँ रात को सवेरे कभी भी. थिंक अबाउट काली बाइक्रोम एंड थिंक अबाउट मर्क्यूरी. Very, very important remedies. Just think about what the patient is telling you. Like the dose of platina I told you, this is also very important. Symptomatic. Define the symptoms in a very correct manner so that the correct symptom comes out. Okay, this is very important. So welcome Ria. Yes, Wasim, ammonium manure and Rostox is also there. So this is something in relation to suddenness. Of course, in suddenness, then there are a lot of, there are a lot of conditions, there are a lot of symptoms also, but I think this would be fine. In general we can say suddenness. Abhi फिलहाल because of the weather there is lot of symptoms of obstruction of nose. डॉक्टर साहब मेरी नाक बंद हो गई, मेरे को गले मतलब मेरे को मुंह से सांस लेना पड़ता. I have to breathe from the mouth. Which remedy comes to your mind? You must think about again काली कार्ब. और आप देखेंगे काली कार्ब कितने ज्यादा इंपॉर्टेंट है. काली कार्ब कितने ज्यादा कंडीशंस में आती है. Think about kali carb, think about lycopodium, think about in fact kali sulf also. Of course, Sambucus niger is always there, Nux vomica is always there. उससे एक ज्यादा. One thing more, yeah, thank you for a lot of hearts on Instagram, but no, I think thumbs up on YouTube we have got. So I hope you're understanding. Okay. Good afternoon, Dr. Jeswal. Good afternoon, Methili. Yeah. And if that obstruction, if a child tells you, especially you will get lot of children who are nursing infants and they say जब भी दूध पीता है ना ये मौसम में उसका नाक बंद हो जाता है. Whenever is drinking milk or anything in this weather, nose get obstructed, especially nursing infants. Think again about Calibacrom, Nux vomica and Lycopodium and Sambucus. And that is the beauty of homeopathy. One remedy which covers at a part, it covers in most of the complaints. I have still told you obstruction of nose in children, in infant, in adults, everywhere these remedies follow. That is the beauty of homeopathy. That is the beauty of our Matremedica. Yeah, welcome Dr. Vikram Singh. And now in children I have to, in nursing infants I have to tell you, and now I tell you obstruction of nose in children. Again, think about Nux vomica, think about Calibacrom, think about Lycopodium, think about Sambucus nigra. This is homeopathy. That is very, very important. Dr. Ashwin, welcome. A chronic left knee pain due to injury, Ruta 1M, Gaultheria 1M, Arnica 1M, helping little. In 45 years, please help. Yes, very good Dr. इंद्रजीत पांडे. और आपने बहुत अच्छा किया कि आपने दवाई सब बता दिए कि क्या दिया है. सी हम लाइफ में फेल होते हैं, कोई बात नहीं, मैं भी बहुत बार फेल होता हूँ, और आपने बिल्कुल सही दवाई दी है कि आपको आर्निका दे दी है, रूटा दे दी, सब दवाई दे दी है आपने. अब देखिए एक चीज सिर्फ ऐड कर लीजिए. अब जब आपने इतनी दवाई दे दी है, सो मेक श्योर कि थोड़ा मेंटल सिम्टम उनसे पूछिए. क्योंकि क्या होता है, हमको इंजुरी बहुत होती है, बट जब भी हमारी इम्यूनिटी वीक होती है तब इंजुरी में तकलीफ होना शुरू होती है. ऑफ कोर्स इफ द इंजुरी इज वेरी सीवियर, आर्निका शुड वर्क. इफ आर्निका इज नॉट वर्किंग, मैं फिर से बोलना चाहूंगा, आर्निका आप एलएम पोटेंसी देके रख सकते हैं, ट्राई कर सकते हैं। बट कभी कभी क्या होता है कि थोड़ा एक मेंटल सिम्टम आपने पूछ लिया, तो लेफ्ट साइडेड नी पेन के अंदर अगर मेंटल सिम्टम ऐड कर दे, तो वट एवर रेमेडी आई हैव सीन इन माई प्रैक्टिस, काली बाइक्रो सॉरी काली कार्ब, वेरी वेरी इंपॉर्टेंट, one remedy is lachesis, colchicum, and fourth is, write down in your mathematics, phytolika. Very very important. Only in one case I have got a fantastic results with iodoform. Iodoform is a remedy. Iodoform, it's from mineral kingdom. So ये आप प्रैक्टिस, ये आप सोच सकते हैं। ओके, आई होप कुछ आपको आंसर मिला। जब भी आपको लगा कि आंसर ठीक है, कुछ ना कुछ मुझे थम्स अप दीजिए, हार्ट दी, सो आई नो दैट सबको समझ में आ रहा है, नो, बिकॉज एक्सटेम्पो इतना मैथमेटिक्स सोच के बोलना मेरे को कभी कभी I also can make a mistake, but whatever I know from my knowledge I can always share with you. So ये 4-5 जगह एक थोड़ा मेंटल एलिमेंट डॉक्टर पांडे जी, इसको आप कर दीजिए। प्लीज गाइड अबाउट नक्स मॉस्केटा एंड नोज ब्लॉक। Oh my god. So nux mosquita. In nux mosquita, I would say I have hardly used nux mosquita. I have not totally not used, but I have hardly used. So nux mosquita का सबसे important symptom is over sensitiveness. मतलब अगर आप यहाँ खाना बना रहे हो तो नक्स मॉस्किटो बोलेंगे, मम्मी आप आज जो डिश बना रहे हो, पनीर की सब्जी बना रहे हो ना, बहुत अच्छी बनेगी, बहुत अच्छा टेस्ट आ रहा है। दैट इज नक्स मॉस्किटो। ओवर सेंसिटिव टू स्मेल, बहुत ही इंपॉर्टेंट सिम्टम है ना। और उसके आगे जाएंगे नोज ब्लीड। अब आप बोलेंगे सर नोज ब्लीड तो बहुत रेमेडीज के अंदर है, बट नक्स मॉस्किटो का नोज ब्लीड बहुत इंपॉर्टेंट है, वेरी वेरी इंपॉर्टेंट डॉक्टर। Nux mosquito nose bleed, the blood is dark blood, dry, or the nose is stopped up. So oversensitive to smell, nose bleed, and dark blood. This is the only symptom I know something about Nux mosquito. That is my experience of treating nose complaint. Otherwise, Nux mosquito, we have seen a lot of children who are spoiled children, who are a lot of tantrums and all, and that is why they oversensitive and hyper children. That is Nux mosquito. थैंक यू डॉक्टर पांडे। डॉक्टर पल्लू ज्वाइन, ओके, वेलकम डॉक्टर पल्लू। समझ में आ रहा है सबको? आई होप एवरीबडी इज अंडरस्टैंडिंग। हिंदी इंग्लिश मिक्स बोल रहा हूँ ताकि हम सबको समझ में आए अच्छे से। ऑफ कोर्स देयर आर लॉट ऑफ फॉरेन डॉक्टर्स आल्सो। थैंक यू सो मच। सो इसके आगे जाएंगे हम नक्स मॉस्किटो। अगर नक्स मॉस्किटो के अंदर अगर मैं बोलना चाहूँ, नक्स मॉस्किटो के अंदर आई हैव सीन लॉट ऑफ केसेस वेयर देयर इज very much hypersensitiveness and very much changeability, laughing and crying. That is nux mosquito. And a nux mosquito patient appears to be very much confused with impaired memory. And a very important symptom of nux mosquito, I remember in a case, the patient बोला, डॉक्टर साहब ये मेरी जबान है ना, माई टंग, मुझे लगता है जबान है ही नहीं, बहुत मोटी मोटी लगती है और कोई सेंसेशन नहीं है। And that was nux mosquito. The tongue feels numb and paralyzed. Nux mosquito. And saliva of nux mosquito is like cotton. याद रखिए दोस्तों, saliva of nux जब थूकता है ना तो ऐसा लगता है कॉटन गिर रहा हूं। That is nux mosquito. So ये सिम्टम अगर आपको पेशेंट में मिलते हैं तो आई बी वेरी हैप्पी टू प्रिस्क्राइब नक्स मॉस्किटो। ऑफ कोर्स ये सिम्टम जो आपको ओवर सेंसिटिव स्मेल बताया है वो नक्स मॉस्किटो में है, बट ये सिम्टम जो मैंने देखा हूं ये मेरे को बहुत अच्छे रिजल्ट देते हैं नक्स मॉस्किटो के अंदर। ओके, सो आई विल नॉट स्टार्ट मैथमेटिका बिकॉज देन आई विल नॉट स्टॉप। सर आपने एसिडिटी का क्या रीजन बताया था? या जब भी मैं देखा हूं एसिडिटी, व्हेन देयर इज लॉट ऑफ बर्निंग, देयर हैज टू बी बर्निंग हियर। कोई चीज का तनाव, कोई चीज का अनरिजॉल्व्ड इमोशन, कोई चीज काम हो नहीं रहा, नथिंग इज हैपनिंग, द लाइफ इज नॉट मूविंग, देयर इज समथिंग विच द पेशेंट वांट्स टू चेंज बट कैनॉट चेंज, वांट्स टू डू समथिंग बट कैनॉट डू, एंड दैट इज हर्टिंग द पेशेंट बिकॉज द पेशेंट इज राइट but cannot speak because she has to compromise with the situation. In those cases I have seen acidity, that's what I wanted to tell you. Getting it done joint, okay. Sir, what remedies can we think for elderly sinusitis where there is no polyp, aggravation only by lying down if side is altered during lying, nasal blockage? Okay, so अभी जो मैंने आपको बताया नोज के अंदर अगर आप देखेंगे एल्डर्स को डेफिनेटली बहुत प्रॉब्लम रहता है और बेचारे वो ऐसे लगता है ना कि सो नहीं सकते, मेरे डैडी को बैठना पड़ता है और फिर क्या जबरदस्ती उनको वो एलोपैथी के ड्रॉप्स डालने पड़ते हैं। बहुत कॉमन है और बहुत अच्छा क्वेश्चन है। मेरे को भी थोड़ा व्हेन आई ऑल्सो स्पीक आई ऑल्सो अंडरस्टैंड कि मुझे भी इसमें सीखने मिलता है। सो अभी हम देखेंगे ओल्ड पीपल के अंदर दैट ब्लॉकेज ऑफ नोज स्पेशली इन ओल्ड पीपल। ऑफकोर्स ओल्ड पीपल के अंदर सबसे फर्स्ट रेमेडी जो आपको ओट्रोविनियस, आई डिड नॉट नेम द ड्रग बिकॉज ओके फॉरगेट दैट। सो ओल्ड पीपल के अंदर आपको सबसे पहले जो ड्रग सोचना है दैट इज अमोनियम कार्ब। ओल्ड पीपल नोज ब्लॉकेज, ओल्ड पीपल कफ, एवरीथिंग, मोस्ट ऑफ यू विल गेट रिजल्ट विद अमोनियम कार्ब। सेकेंड सिम्टम ओल्ड पीपल के अंदर मैंने बहुत इंपॉर्टेंट देखा हूं, इसके अंदर मिलता है दैट इज सिलिशिया। थर्ड कैलकेरिया कार्ब। फोर्थ अगेन दिस इज ऑफ कोर्स कॉमन रेमेडी आल्सो दैट इज पल्सिटिला। और इसके अंदर बहुत इंपॉर्टेंट ये देखना कि ये ऑल्टरनेट लेफ्ट राइट फिर होते रहता है। तो अभी अपने जैसी पेशेंट, आपने जैसे बोला है कि जब भी डॉक्टर साहब वो सोता है फ्लैट तो नाक बंद हो जाता है। मेरे दोस्तों ये ड्रग लिख लीजिए, बहुत अच्छा रिजल्ट दिखाता है, दैट इज मैग्नीशियम म्यूर। वाइल लाइंग देयर इज ऑब्स्ट्रक्शन इतना ज्यादा कि वो सो ही नहीं सकता, मैग्नीशियम म्यूर। कभी कभी पेशेंट बोलता है मैं सो सकता हूं, फिर बीच में उठना पड़ता है, दैट इज अगेन नक्स मॉस्केटा, कॉस्टिकम, बोविस्टा एंड पल्सेटिला। ओल्ड पीपल, okay. Just one case on Instagram, I just finished that. Dry eruptions on neck, groin, arm, leg, itching until bleeding without eruptions, aggravation after lying in bed, especially night. Yeah, you can think about common remedies like sulfur, calcarea fluor, petroleum and acid chryso. Dr. Mukesh, welcome. यदि किसी दवा की हाई पोटेंसी दी गई और कुछ दिन बाद उसी दवा की लो पोटेंसी देने पर हाई पोटेंसी एंटीडोट हो जाएगा? नहीं, ऐसा कुछ नहीं है। इट इज नॉट, ऐसा कुछ नहीं है। आपका सिमिलिमम सबसे ज्यादा इंपॉर्टेंट है एंड उस सिमिलिमम के बाद वो अगर आप दवाई आपकी सिमिलिमम है वो डेफिनेटली काम करेंगी। हो सकता है उसका काम करने का जो व्हाट यू कॉल ये हो, क्या बोलते हैं, एक्शन हो थोड़ा स्लो हो जाए, बट दवा डेफिनेटली काम करेंगे अगर सिमिलिमम है तो। एग्रीफस नट, अभी मैंने इसलिए बोला कि ज़्यादा मटरमेडिका पे जब हम आ जाते हैं ना तो फिर मेरा एकदम ज़्यादा शुरू हो जाता है मटरमेडिका एमएमएम। बट एग्रीफस नट ये बहुत इंपॉर्टेंट दवाई है ऐसा नाक के लिए। नाउ एग्रीफस नट वॉट एवर माई एक्सपीरियंस इज देयर, ऐसा इट इज लाइक जब भी किसी बच्चे के अंदर एडिनोइड्स का प्रॉब्लम हो और वो एडिनोइड्स की वजह से एडिनोइड्स की वजह से तो कान में बराबर सुने नहीं आ रहा हो या गले में बहुत तकलीफ हो, ये नाक पूरा बंद हो, नाक हमेशा पजरते रहता हो, दैट इज एग्रीफस नट। एंड इन एग्रीफस नट द पेशेंट इज प्रोन टू टेक कोल्ड और एक्सपोजर टू कोल्ड विंड। जैसे अभी ठंडी का मौसम है, अभी बहुत बारिश हो रही है तो बहुत ठंड चल रही है नागपुर में, ठंड में गया मेरा नाक बंद हो गया, एग्रीफस नट। This is the importance of egrifous nut, and of course because of that adenoids, then your tonsils, for enlarged tonsils because of cold wind, egrifous nut, tendency to free discharge of mucus membrane, जब भी मैं ठंडी में जाता हूँ मेरे को नाक पे जरना शुरू हो जाता है, तो throat complaints, ear complaints because of cold water, think about egrifous nut. What's the medicine for scabies in children, itching, aggravation? You can think about sulfur, sulfamum, rustox and rasuen. सर आपने मेरी सही प्रॉब्लम का इमोशनल और मेंटल रीजन के टर्म्स बताया, दैट वाज रियली आई ओपनिंग, यू आर अ जेम। इतना नॉलेज बहुत ही कम डॉक्टर्स के पास है। इट वाज नाइस मीटिंग यू ऑन यूट्यूब लाइव। ओके, थैंक यू डॉक्टर विक्रम, थैंक यू सो मच। एंड आई वुड लाइक डॉक्टर विक्रम, आप भी मेरा एक एलएम पोटेंसी का 11 तारीख से 4 दिन लेने वाले, आप ज्वाइन कीजिए, आपको और मजा आएगा। आई होप यू एंजॉय दैट। फियर ऑफ कैंसर इन थ्रोट, एनी स्पेसिफिक रेमेडी लाइक प्लेटिनिया? नहीं, देखिए फियर ऑफ कैंसर जो तो मैंने बताया आपको, बट वो कितना मैच होता है कभी कभी होम्योपैथी कितनी मैच करती है, ये बहुत इंपॉर्टेंट है। अभी आप देखेंगे कि फियर ऑफ कैंसर इन रिलेशन टू थ्रोट, मैंने तो आज तक देखा नहीं कभी, मेरे पास कोई सिम्टम भी नहीं आया बिकॉज पेशेंट लगता है। बट इसके अंदर 3 रेमेडीज बहुत इंपॉर्टेंट है डॉक्टर पाल। फर्स्ट इज कैलकेरा कप, सेकंड इज सोराइनम एंड थर्ड इज कालियार्स। वेरी वेरी इंपॉर्टेंट। Dr. Anwar, welcome. Sir, if you are prescribing on physical complaint, then really mental symptoms are important. Very nice question. और आप आंसर सुन लीजिए, आप कौन से फिजिकल कंप्लेंट्स पे प्रिस्क्राइब कर रहे हैं, दैट इज वेरी इंपॉर्टेंट। इफ द पेशेंट हैज कैंसर, उसको फिजिकल सिम्टम है कि इतना कैंसर बहुत ज्यादा है, पूरा डिस्चार्ज निकल रहा है, इतना कोडिंग डिस्चार्ज है कि उसकी पूरी कपड़े भी फट गए हैं। This was a case in my practice. I just because of this symptom I prescribed just by this symptom Mercor, because that is also a syphilitic symptom. The discharge is corroding the linen. Syphilitic हो गया ना, तो syphilitic बीमारी के अंदर अगर syphilitic symptom लेके प्रिस्क्राइब करेंगे तो आप डेफिनेटली आपको रिजल्ट आ जाएगा। syphilitic mental symptom मिलता है वो बीमारी के अंदर, प्रिस्क्राइब कीजिए, आपको रिजल्ट मिल जाएगा। सो डिपेंडिंग ऑन द माइजम, आपके पास माइजम अगर पता है तो आप वो माइजमेटिक सिम्टम लीजिए, चाहे माइंड हो चाहे बॉडी हो, दोनों में काम करेंगी दवाई। तो अगर सिफिलिटिक माइजम का पेशेंट है तो सिफिलिटिक सिम्टम लीजिए, साइकोटिक का तो साइकोटिक लीजिए, ऑटोमेटिकली आपको रिजल्ट मिलना शुरू हो जाएगा। ऐसा जरूरी नहीं कि अगर आपको कैंसर मिले तो माइंड पे जाइए, कभी कभी फिजिकल सिम्टम भी अगर सिफिलिटिक मिल रहा है तो बिल्कुल प्रिस्क्राइब कर सकते हैं आप। वेरी वेरी इंपॉर्टेंट, यू नो, इट इज अमेजिंग हाउ अप्रूवर्स हैव, या विबिनोपोलस लेने पर मेडिसिनल एग्रेवेशन हो जाए तो क्या करे? सी वाइब्रिनोपोलस, आई डोंट नो आपने कौन सा पोटेंसी यूज किया, बट मेरे पास ऐसी वाइब्रिनोपोलस के कभी सिम्टम यूज नहीं हुआ है, एग्रेवेशन नहीं हुआ है। बट जब भी आपको ऐसा सिम्टम मिलता है कि होम्योपैथी एग्रेवेशन हो गया तो वेट, और इसके लिए मैं आपको बताऊंगा, क्योंकि टाइम हो गया है, प्लीज रीड केंट्स 12 ऑब्जर्वेशन, उसके अंदर आपको इसका आंसर मिल जाएगा। बट मुझे आज तक वाइब्रिनोपोलस का कभी भी एक क्या बोलते हैं मेडिसिनल एग्रेशन का सिम्टम नहीं मिला है। सो वेट करिए, एंड आपको लगता है कि एग्रेशन बहुत तकलीफ हो रही है, यू कैन एंटीडोट विद दी मेडिसिन विच इज रिटन इन द मटर मेडिका। मदर टिंचर, no, you cannot get aggravation in mother tincture. Of course the existing symptom, maybe it is possible that बढ़ गया हो because it can cause severe bleeding and all. अगर आपको ऐसे लगता है डॉक्टर मौर्य, तो आप एक काम करिए कि उसको पोटेंशियम में दीजिए एक डोज, 30 के एक डोज, तो मेरे ख्याल से फर्क पड़ जाएगा। इनफर्टिलिया, सर अगर कॉन्स्टिट्यूटिव मेडिसिन चल रही है तो बीच में एक्यूट सिम्टम के लिए दूसरी साथ में दे सकते हैं, बिल्कुल दे सकते हैं, कोई प्रॉब्लम। बिकॉज अगर आपने, मेरे पास एक रीनल फेलियर का पेशेंट आता है, सडनली बहुत ज़्यादा सर्दी होती है, हम बोलते हैं वेट करने के लिए, इतनी सर्दी हो गई कि बुखार आ गया उसको, तो एलोपैथिक खाना पड़ रहा है, तो होम्योपैथी दे दीजिए उसको। सो ओके, so I think it is already half an hour up, or thank you everybody for joining me. Hopefully we can see everybody on our next webinar, which is on 11th, 12th, 13th, 14th of this month, from Monday, Tuesday, Wednesday, Thursday. Flyers मिल जाएंगे, you can see my Facebook page and you can join in. I hope it would be very happy learning experience for everybody in LM potency. So meet you on Zoom on Monday, Tuesday, Wednesday, Thursday. You have my flyer, you have my number, you can register with that number. Okay, so thank you everybody, thank you for joining, and I hope you enjoyed as much as I enjoyed sharing my experience with you. Thank you so much.